Poor health and disease have been identified as major barriers to economic growth in developing countries. Ghana is no exception, as its workforce faces myriad of health problems and its attendant costs. Against this backdrop, the erstwhile NPP government introduced the National Health Insurance Scheme in 2003 to provide basic health care to the ordinary Ghanaian. This saw the phasing out of the cash and carry system. The NHIS was to correct the ills of the cash and carry system, where the disabled, poor and accident victims were asked to pay upfront before getting health care. 8 years down the line, TV Africa News finds out whether the ordinary Ghanaian is fully enjoying the benefits of the National Health Insurance Scheme. At one of the accredited private clinics in the Greater Accra region, where our reporter Kwete Nate went in as a patient in a critical condition, it was observed that one had to pay for the laboratory tests and drips, services which are supposed to be covered under the National Health Insurance Scheme. Without money, a patient is denied access to these services, as was gathered. Bearers of the National Health Insurance Scheme card had to queue for not less than 2 hours before they see a doctor, sometimes degenerating into fisticuffs and verbal exchanges. What presumably was free was the ID card and care provided by the hospital during the investigation. The negligence of some health officials, notably nurses, was common, as it took a nurse 20 minutes to attend to a situation while a reporter's blood was oozing from a drip. The only drug administered under the National Health Insurance Scheme was a paracetamol for a patient suffering from food poisoning. The rest of the drugs are prescribed to be bought at any pharmacy.
The first one I can see you. You can see the first one. What about the other two? The third one. You have the third one. This one has been cancelled. Oh, okay. We have this one. Okay. How much is the cost? That will be 40 to 80%. 80%.
To find out what the situation pertains outside the Greater Accra region, TV Africa News visited a government hospital in Suhum in the eastern region. One striking revelation was that health officials extort 1 Ghana cedi from patients with NHIS before preparing their ID cards.
If you ID card is not expensive, so they are open up to the and then nothing else because the ID card. Because none of them will not say it's not a blue one. If you didn't have a
The National Health Insurance Scheme, if not critically looked at before the one-time payments premium is rolled out, the ordinary Ghanaian would be priced out from accessing basic health care.